Hi, I'm Chris Wade and I am a consultant speech therapist and I work with children and adolescents with autism spectrum disorders and other neurodevelopmental disorders. And today I just wanted to just go over the kind of the what I'd see as the typical kind of gold standard approach to diagnostics when it comes to autism, because I'm part of quite a few different Facebook groups, and what concerns me is families are often kind of put on these kind of long 18 months to up to 3 year waiting lists for social communication disorders, and because they want to in a sense skip the list and find out what's happening, they often go private. And my concern is that when a family wants to go private, they often are looking for one particular assessment, and families are often looking for an ADOS assessment. So that's the Autism Diagnostic Observation Schedule. And what I wanted to just go through now is what the kind of what I would see is the kind of gold standard approach to diagnostic work when it comes to social communication disorders, and it's what we used to do when I was in the NHS. So in the NHS team that I was in, which was in kind of northwest London, it was led by me and a clinical psychologist and a paediatrician. And the main approach was to, one, look at the medical side of the child. So the paediatrician would send off the blood tests, they do send off a hearing and vision tests. So you've got the medical bit sorted. So you've looked at kind of any abnormalities from the bloods, you've looked at what their hearing's like, you've looked at what their vision's like. The next step would be to look at the child from an observational perspective in whichever setting they're in. So if they're in a nursery or in a school, to attend and in a sense being a fly on the wall and just see how their social communication skills are, what their general kind of play skills are like, what their learning's like, how their joint attention is, what their language is like, if there's any kind of sensory things, any behavioural things that you're looking out for. So the observation we always felt was kind of, well, it was integral to making any diagnosis. And then we'd look at a speech and language assessment. So a speech therapist would go in and they'd do either a kind of informal assessment or, if possible, a formal standardised assessment. So we'd have some kind of clear scores to compare the child against their kind of age-matched peers. And that'd be part of kind of a wider dynamic assessment. So it wouldn't just be one assessment, it'd be a kind of whole battery of assessments the therapist would carry out to really work out if, from a differential diagnosis perspective, whether it was just social communication disorder, if there's any other communication disorders on top. And then separately, there'd be a clinical or educational psychologist that would look at the cognitive skills of the child, so look at if there's any potential learning disability, and look at what their learning profile would be. And then we'd look at potentially an occupational therapist going in and having a look at where their sensory skills are, what their fine motor skills are like, what their gross motor skills are like. And they'd carry out, so again, some similar to everybody else, looking at kind of formal standardised assessments, then some informal observations. As part of this whole process, there would typically be either an ADOS, so the Autism Diagnostic Observation Schedule, or the DISCO, which I don't know what stands for. But one of these two assessments, either the ADOS or the DISCO. And then separately, there'd be, for the team that I was in, and the team that I work with independently still, it'd be the Autism Diagnostic Interview Revised, which is the ADIR, which is a whole bunch of kind of questions which looks diagnostically at the child's development from essentially where the parents' concerns were from birth onwards, and then particularly around that age 3. And then for older children, comparing where the child's kind of a whole bunch of behaviours. There's 90 odd questions. It's a very structured kind of 3 to 4 hour interview, which again is kind of part of the gold standard approach. So I have the ADOS, the ADI, and the DISCO. And then what we do as a team, as a multidisciplinary team, we'd then kind of go through all that information, and we'd in a sense map it out and look at, right, okay, there's communication difficulties, there's potential cognitive difficulties, there's sensory needs, and there's kind of look at what we found on the observations, look what we found in these standardised assessments, etc. Look at what the case history means. And then we'd, as a team, so that would be the clinical psychologist, paediatrician, speech therapist, and often an occupational therapist, we'd then come to a differential diagnosis as to what was if there is a descriptor or a particular label for that meets those needs, or more than one label, then we kind of come to a conclusion based on either the ICD-10 or the DSM-5, which are the diagnostic manuals, international and UK, what the child label would be. And then we'd consider as a team whether the family or whether the child would, in a sense, benefit from a particular label. So if they meet criteria, so diagnostic criteria, what would the benefit and the, in a sense, drawbacks be for accessing, or not accessing, being given a particular label at a particular age? And because often receiving a diagnosis doesn't often mean kind of automatic access to services. It might mean that services may withdraw because you've got a particular label. So everything needed to be considered before we came to a diagnosis. And what we'd find is that, sorry, I'm quite slouched. What we'd find at the end of it all is we probably spend, we're looking at probably 6 to 8 sessions across 3 to 4 different professionals, and then bringing it all together, a kind of equal-minded, equal respective clinicians to work out exactly what's happening with that child, and how to best support the family. So you've got a real kind of idea. So it's not a case of, is it autism or is it not autism? It is a case of, is it autism? What's the kind of the severity of the autism? Is there a developmental language disorder? Is there are there sensory needs? Is there a learning disability? Is there a developmental coordination disorder? Is there dyslexia? It's a whole bunch of kind of neurodevelopmental kind of diagnoses that we're considering when we're making that differential diagnosis. And I guess the last thing I wanted to just point out is that in the UK, there's only 3 clinicians that can, I think the word is legally, but there's only 3 clinicians that can give an autism diagnosis, and that's either a clinical psychologist, a child and adolescent psychiatrist, or a paediatrician. Nobody else can legally give the diagnosis. So we can do the assessments. I can do the ADOS, I can do the ADI, I can do a whole bunch of assessments, but I can't physically give the diagnosis as a speech therapist, and I wouldn't based on just an ADOS or an ADI result, because these are just tools to help us. I hope that clarifies things. I know things are a little bit different outside of the UK in terms of who can give the diagnosis and what assessments are typically used. But I think hoping this will be quite helpful for families who may have been given a diagnosis based on one individual clinician and then still have concerns around kind of other areas. So often a paediatrician may have given a diagnosis, or a psychologist may have given a diagnosis, but there may not have been additional assessments. So this might kind of, I'm hoping, kind of help you to ask the right questions as to whether we've got a clear understanding of your child's kind of strengths and needs. Okay, thank you. Bye.